All right. Thank you so much for attending our session today. Today, our presenter and speaker is Dr. Daniel Bernard Hajowski. Hopefully, I spell it all correctly. And he is an associate professor and associate department head in the Department of Educational Psychology at Texas A&M University. He's a faculty member in the school psychology program, where he also serves as chair and director of clinical training of the APA accredited program. Dr. Hajowski is a licensed psychologist and nationally certified school psychologist. Most of his clinical work has focused on evaluations for children and adults with learning disabilities and ADHD. His research interests are generally in the areas of assessment and measurement, and specifically the assessment of academic and cognitive abilities, identification of specific learning disabilities, and the longitudinal development of psychological and contextual factors that affect academic, social, and behavioral skills. He is an associate editor for Journal of School Psychology and an associate editor for Journal of Psychoeducational Assessment. Thank you for coming with us, Dr. Hajowski, and please feel free to start your presentation.
Okay, thank you so much for that warm introduction. And good afternoon, everybody. Happy Monday. Thank you for tuning in. I first want to start off by saying thank you to CTE. It was an honor to be a part of the generative AI learning community, and this is sort of the capstone experience of that. And I really wanted to get involved with this community and this project, really just to learn more about AI. I don't fancy myself as someone who has lots of technical expertise, but I really wanted to join this community to learn more about AI, how it's being used in the classroom, how it's being used in different fields of study. And so I just want to, again, thank CTE for that opportunity. So I'm within the field of school psychology. So we train, we're a doctoral only program. We train health service psychologists to be able to work with really with children and adolescents is kind of the core focus of the field of school psychology. And so a lot of our research and training is focused on supporting the learning, the emotional needs, the mental health needs of children and adolescents. And that also involves diagnosing different learning disabilities like dyslexia, autism spectrum disorders. So a lot of our training revolves around that kind of focus. One of the big things within school psychology has been how do we not spend so much time on report writing, or at least how can we make it more efficient, more optimal? And so I really wanted to kind of hone in on this topic and figure out how can generative AI be assistive to helping us with psychoeducational report writing. So as I get in, I first want to acknowledge a few folks. So again, here's our symbol for school psychology. I also want to point out that a lot of the information I'm sharing today was garnered within this building right here on the bottom right that stands for CAC, or the Counseling Assessment Clinic. It is a professional training clinic for both our school psychology and counseling psychology APA accredited programs. We also conduct research there. And so I also want to thank all the folks who are involved in that allow us to do this work. Stephanie Liu is a second-year school psychology doctoral student in our program. She was involved with a lot of the work I'm going to share today, as well as she's leading a research project that I'm going to share a little bit of information with you about today. I also want to thank our CAC director, Dr. David Kane, who is a clinical assistant professor in our school psychology program. And I also want to thank Dr. Anita McCormick, who is a clinical associate professor in the counseling psychology program. Again, she's involved with a lot of the research project I'm going to share with you today, as well as a lot of the skills that we've developed. And then last but not least, I also want to thank you all for attending this presentation this afternoon. Thank you for sharing your time. So quick overview of the presentation, just kind of a quick rundown. I know I only have about 15 or so minutes. I just want to briefly mention, what is psychoeducational report writing? What does some of the current research say about generative AI in report writing? There's been a proliferation of research, and I'm only sharing just a couple studies with you. And then I want to discuss a few use cases of generative AI in psychoeducational report writing, as well as a current research project. So the use cases I'm going to share with you, there are about 5 or 6. Again, they're very pragmatic examples of how AI can be used with report writing or as, serving as a consultant. And then last, I want to share what has been some of the impact on classroom instruction, as well as some of the student trainees' perspectives as they use generative AI in their course. So first, briefly, what is psychoeducational report writing? Overall, it's a way to collect data to make a more informed decision. And the report basically serves as a way to summarize all those assessment results, help identify strengths and weaknesses about a client or patient that we're working with. It can also serve as a means to document a diagnosis or an identification. If we're diagnosing something like a specific learning disability like dyslexia or ADHD or something like autism spectrum disorders. And then lastly, it can help us to guide and plan interventions or treatment that we'll offer. So overall, the report writing process is a way to help us document that. In terms of the state of affairs of report writing within our field of school psychology, this was taken from a Reddit board. So this is just one quick example. You'll see the acronym NASP referenced a lot. That stands for National Association of School Psychologists. That's one of our governing professional organizations. But bottom line, what this practitioner noted is that they've been in practice for over 35 years. At one point, they were writing over 150 pages a month. Um, as we'll learn, reports can vary quite a bit in terms of length or size. Some may only look like a couple pages, some can look like 30 or more pages. But the bottom line is this can be a very time-intensive process. And what one of the practitioners noted on this message board is that they would rather spend much more time in direct service deliveries to the client rather than engaging in a lot of report writing, right? And so we've seen this be a theme for quite a long time, and this is one of the reasons why we think AI can be helpful within this realm. To ask the question, can AI help with report writing and are school psychologists using it? I just want to share a couple empirical studies that were conducted. So this one just came out in 2024, led by Adam Lockwood, who's been sort of spearheading a lot of this research within our field. And they basically wanted to evaluate ChatGPT-4's ability to generate psychological reports, where they used mock data, so they made up the data, and then they tested it against humans' ability to generate psychological reports. So they used 249 licensed psychologists throughout the United States who rated all the reports. And again, they looked at an AI-generated report versus a human-generated report. The different criteria they looked at were overall quality, polish, professionalism, readability. Readability is typically operationalized as how difficult is it to read? Is it written at like a sixth grade reading level versus like a 12th grade reading level? They looked at overall writing style, organizational structure, just the quality of the summary of results, and then finally recommendation quality, the number of recommendations and how good were the recommendations. And so they looked at different reports for ADHD, intellectual disability, formerly referred to as mental retardation, but now referred to as intellectual disability, depression, and anxiety. And so interestingly, I just want to share with what some of the results they found. Human-generated reports were preferred for overall writing style, the organization of the report, and the overall quality of the report. However, there was one area that stood out where AI-generated reports tended to favor a little better, and that was in the area of recommendations. Particular AI shows promise in augmenting psychological reports, especially for producing recommendations. They did find that human expertise is really crucial for summarizing information. So this comes along the theme that I'll bring up later, is that AI may be a consultant, but it certainly doesn't replace the human or the human decision maker. They also identified there is a real need for professional guidelines on AI within psychological practice, as well as updated curricula for future psychologists. And I'll share a little bit of guidance from one of the main professional governing organizations of our field, which is the American Psychological Association. Here's a survey that was done in Ohio, and this was just recently done from December 13, 2024 to January 16, 2025, so very recent. And they were able to capture, they found 80% used AI in the past 6 months. 69% found it helpful for, or at least they used it for work-related tasks. Some common applications by far well, not by far, but the majority was for generating recommendations. We also found that it may be helpful with assisting with report writing. When they answered questions related to trust and concerns, uh, about 3/4 found that AI was helpful. Um, Only 36 felt that they could trust AI content, and about only around 35% believe that AI was better at some tasks, not necessarily all tasks. Ethical concerns that were raised in terms of report writing, at least in this specific survey, was around 66% had concerns of an over-reliance on AI. So there were concerns there that we were relying on it too much. 69% had concerns with privacy risks, especially as it relates to FERPA and HIPAA. There was also around 40% concern with job obsolescence in terms of is AI going to take away our jobs eventually? And then a recurring theme that we've seen with AI was a concern with bias. Is it producing biased results in terms of the data that the AI algorithms have access to? And lastly, training resources came from colleagues, webinars, or in person. So that was kind of the breakdown there. So again, these are just two kind of quick studies. There's been a lot of studies in the last year within our field in terms of AI. So what is the current guidance on AI use in our field specifically? So this is a frequently asked questions document put together by the American Psychological Association Ethics Committee. And what APA identified is that they're currently working on an updated ethical principles of psychologists and code of conduct, what we call the ethics code. And this will help include guidance around ethics and technology. But the one thing I do want to point out in the blue highlight is that, for example, ChatGPT, which has been used pretty widely, while ChatGPT has the potential to enrich clinical training as an assistant or consultant when used without sharing confidential clinical data, it is not currently a replacement for human decision-making or critical thinking skills. So again, I just want to hit home this message that generative AI like ChatGPT or Copilot, these tools may be useful for acting as a consultant or an assistant, but they do not replace the human decision maker or the psychologist in terms of the outcomes or the critical thinking to get to those outcomes. Okay, in terms of use cases of generative AI and psychoeducational report writing, I want to preface that these were developed and used by students within a child therapy practicum course where they see real clients in that CAC center, the picture I showed you. All information is de-identified, so there's no confidential information shared here. But these were some different use cases that were developed where students got to try out using how can AI be helpful in terms of report writing and the assessment process. The other thing I just want to note is that um, as part of this course, they did a kind of a smaller scale assessment. It wasn't a full scale comprehensive assessment that you may typically see. For this course, they were only doing a much more narrow assessment with their clients. So I just want to make that point clear as well. In terms of one use case where students found AI helpful, it was simply summarizing data for reports. So here is an example where a student asked Microsoft Copilot to please summarize the BASC-3 scores into a paragraph that they could insert into their intake report. And what the BASC-3 stands for is the Behavioral Assessment System for Children, third edition. The way I describe the BASC-3 is it's an overall omnibus measure that casts a wide net to capture social, emotional, and behavioral functioning of a client. It asks a lot of different items and it captures social, emotional, and behavioral functioning. And Microsoft, Copilot shot back, yeah, they'd be happy to. And so the student then basically inputted the scores. So Here are the scores that are highlighted in blue here that the student entered. These are based on T-scores, so an average of 50, standard deviation of 10. But bottom line, they just listed in the scores here, just to kind of give you an idea. And when you see how the scores are listed, it doesn't give us any qualitative information about whether they're low, they're high, there's at-risk concerns, anything like that. It was just inputting the scores. And this is what the Copilot gave back. So basically, you can see it gives a little bit more description in terms of saying there are moderate concerns here. Um, there's a profile that suggests some concern in the area of anxiety, attention, and other areas. So it does provide some clinical information, but it does highlight that we would need further exploration and support before making any diagnosis. And that's what we see as being consistent with APA in terms of ethics. The other thing I just want to say out loud again is this is just one measure. We would never diagnose any patient or client with just a single measure. So I also just want to kind of say that out loud here as well. So for one just very straightforward method, AI has been found to be helpful, at least with our students, in summarizing some data for reports. Another example here that I want to share is helping to form diagnostic impressions. So again, this is just an example of a simple diagnostic impression. The data are too limited for diagnostic purposes. So uh, here's an example that we altered to protect confidentiality. But it says, I am a therapist seeing a client for family trauma related to his mother's gambling issues. The client has also just moved to a new town to obtain his undergraduate degree. He is new to town and has no friends or family in town. So during the intake survey, our student trainee was able to gather this information from the patient. So, for example, I tire frequently. The patient answered frequently. When asked if I'm concerned about family troubles, they answered frequently. I have difficulty concentrating frequently. I am not working or studying as well as I used to frequently. I feel my love relationships are full and complete, and they indicated rarely. And then basically we asked the co-pilot, what DSM-5 diagnosis should I give this person just to help act as a consultant? And so this is what it gave us back. Based on the client's intake survey responses and background, several different DSM-5 diagnoses can be considered. So here are some possibilities. I won't go into detail of each of these except just to highlight that it gave back different potential diagnostic impressions like adjustment disorder, major depressive disorder, generalized anxiety disorder. It even brought up some B codes, some other conditions that may be a focus of clinical attention. And I really like that Copilot gave back this point here. It's important to conduct a thorough assessment to determine the most accurate diagnosis, consulting the DSM-5 criteria for each of these disorders, and considering the client's full clinical picture will be crucial. Would you like more detailed information on any of these diagnoses? So here, what we found to be, the students found to be helpful was that AI could help act as a consultant or at least give some alternative hypotheses or explanations that may explain what may be going on here. The student trainee would certainly have to follow up with the DSM-5 criteria. And if they believed it may be due to something like major depressive disorder, they would then have to follow up with additional assessments to kind of tease out what may be going on. But in terms of just helping act as a consultant, this helped give the student trainee some different ideas. On the same theme of acting as a consultant and helping to, in this case, differentiate different diagnoses, the student trainee asked with one of their clients, can a child have sensory issues and difficulties with transitioning, but not have autism spectrum disorder? And they asked this because one of the things we often see is, or what we can often see are sensory issues or difficulty with transitioning with someone who may be suspected of having autism spectrum disorder. But we wanted to see, could there be other potential explanations? And so, and ask that question, it says these challenges can be associated with various other conditions or even occur independently. And so it gave back different options like sensory processing disorder, attention deficit hyperactivity disorder or ADHD, different anxiety disorders, or obsessive compulsive disorder. Again, here's another example where the student trainee in practice, they may have different hypotheses, but they want to differentiate from other potential diagnoses or vet other potential diagnoses, AI can be helpful in generating other potential explanatory options. Here's a very straightforward example that they found helpful, making a report language easier to understand. So the student asked, I am writing a psychoeducational report. Can you please improve the following language to make it easier for readers to understand? So this definition of executive functions, this is a very jargony, I would say almost kind of sterile way to write this. And so the way it would be written is executive functions are a collection of processes that are responsible for guiding, directing, and managing cognitive, emotional, and behavioral functions, particularly during active novel problem solving. So this is an example where, again, it's jargony. I understand what it's saying, but it's not necessarily real user friendly. So we asked AI, can you help us make it a little more user-friendly for the report? Because in the report, we do use a lot of these different terms, but we want to convey it in a very user-friendly manner where it makes more sense. And so we asked Copilot to do that, and then they redefined it. Executive functions are a set of mental skills that help us plan, focus, remember instructions, and manage multiple tasks. These skills guide our thinking, emotions, and behaviors, especially when we are solving new and challenging problems. And me personally, as a parent, if I were to see this, I much more prefer the second definition of executive functions and can make much more sense of that when reading a report. It's much more easier to understand for me as well. So students reported finding this to be a really key, helpful example of AI with report writing. Here's another example. So as part of our kind of assessment process, one of the things that we do is conduct clinical observations. So while we're completing direct assessments, filling out information, we also want to see, do these things occur in the environment when we're observing different clients? And so here are just some notes. Again, these are de-identified. These are just some different notes that we're taking during a behavioral observation. The WISC-5 is an IQ measure. That's the block design is just one of the subtests. The Wyatt-4 is a norm referenced achievement measure. Again, those are just some general observations. So these are just notes that you may be taking quickly. You don't always have time to write out a nice, cohesive, concise paragraph live. So you're typically just jotting down notes. But then we asked Copilot to summarize this. I won't read this here, but this just did a really nice job of summarizing the behavioral observations and really helped integrate in that information. The one thing I would also note, though, it was really important to go back and vet this and to make sure that everything listed here is accurate and was behaviorally descriptive of the client. So I think it was really important for the student trainee to go and make sure that this was accurate. Um, As we've seen with some of the empirical research, generative AI has been helpful in generating recommendations. So here we just asked it, please generate recommendations for dyscalculia or a math disorder, ADHD, and autism spectrum disorders. Again, I won't go through all these, but what's really nice is AI breaks down by disorder category different evidence-based interventions that could be helpful for providing to the client. What I really like about this, and something I've seen in my own practice, and I don't currently practice now, but in the past, is that generating different recommendations can be a struggle. And I think AI can be really useful to giving us a really nice menu of options to choose from or to go and follow up on to provide the client. Just real briefly, I just want to share within the next couple minutes here, and I'll be done. A current research project we're doing with generative AI and report writing. I don't have any type of results to present to you, but it's something that we're just starting up. Stephanie Liu, the second year school psychology doctoral student I mentioned, she's leading this project along with several licensed psychologists. And basically, we want to assess the value of applying AI in psychoeducational report writing, more specifically here at Texas A&M. And so we're going to use Microsoft Copilot 365, which is a large language model. And we want to know, does Microsoft Copilot generate better quality psychoeducational reports compared to school psychology student written reports? And so the way we're doing this is we're going to go through IRB and get approval to do all this, but we want to use previously written reports that are at the CAC, and we want to take that data and de-identify it, put it within the large language model, and have it produce a report, and basically have licensed psychologists rate whether the AI generated reports versus the student written reports, which one is better in terms of quality, in terms of accuracy, in terms of potential diagnostic impressions. So that's something that we're going to do. We're hoping to have around 100 or so reports to do that. But we're going to look at does the student written report or does the AI generated report produce better recommendations, better summaries, um, overall better quality, and more accurate diagnostic impressions as rated by licensed psychologists. So kind of that's the goal of the study there. And unfortunately, we don't have anything to present there in terms of the findings. But again, yeah, here's some of the impact of the study. So, again, a better understanding of the accuracy and efficacy of using generative AI to aid in report writing, better understanding of the potential for school psychology student trainees to utilize AI as a consultant in various aspects of their report writing. So, for example, we know AI, at least what some of the literature says, has been somewhat helpful in treatment goals or within recommendations, but can it be more helpful in terms of formulating case conceptualizations or diagnoses? Um, the last thing I just wanted to show you here is just what has been the impact on generative AI on classroom instruction and student trainees. Um, NASP is that our other professional organization that I mentioned, and they put out a technical assistance brief on the use of AI in the training of school psychologists. So some of this here has been known that AI may result in inaccurate assertions. It may result in the inclusion of invalid references or result in errors in formatting according to APA style, which we've known about. Um, I think it's also here in the green to highlight that different AI platforms have different data sharing policies. So meaning that if any confidential information is entered, it may be used to further refine those language models for future use. And this would violate privacy laws such as FERPA and HIPAA. So we have to be aware of what are the different data sharing policies of these different platforms. We only use Microsoft Copilot, but I will say there's something called School Psych AI, and there's another one I can't think of. We would like to use these other more field-specific AI tools, but we weren't able to fully vet them through all the IT process here at A&M. So we weren't able to use those, but in the future, that'd be something that we'd like to explore. I think the purple is really helpful when it comes to professional student training. AI may be most helpful for students and trainers before or after a period of critical thinking and planning has already occurred. AI is not a substitute for thought. And so what I just want to say here, what we found, it's really important for students in our program to first have foundational and didactic training in psychopathology and diagnoses and therapy before they use AI. We only want to bring in AI into instruction after they've had some foundational training within our field. That way, they can be more critical consumers and users of AI as they bring it into their own training. I thought that would be really helpful. Again, AI can also be helpful in brainstorming different lists of ideas. Um, the author can then use that for completing writing later on. This is just a model that was developed within our field to evaluate levels of risk and mitigating risk. So we say if there's a red high degree of risk, red light, green light. If there's a red, that means personal information is used and high risk if actions go wrong. If we get a rating of high, it's important for the individual, the practitioner, to go through an ethical problem-solving process to make any final determination whether we should use this. If it's yellow or green risk, that means no personal information is used, and there's either moderate risk or minor risk if actions go wrong. So it's just kind of it's a it's one way that we can kind of evaluate risk with AI and whether we should be using it or not. Okay, last thing here in terms of impact on the student clinician and using AI. Here's what they reported. Cognitive offloading. So clinicians can rely on AI to help reduce some of the mental workload. Some of that cognitive offloading was helpful. But on the flip side of that, there was concerns with overuse of AI. It can diminish some critical thinking and creative problem solving. That over reliance on AI versus the clinician doing or the student trainee doing some of their own kind of problem solving and thinking. In terms of their sense of self-efficacy, students reported that it can actually lower some of their self-confidence in their own clinical judgment because they are over relying on AI for input on diagnoses or differentiating diagnoses. So one suggestion that we found is that using AI in a group supervision format, so that's having all the students and the instructor together, where they're using AI to discuss ideas, and then the group can then discuss the quality of that AI output. That helps kind of serves as a little bit better checks and balances there. So that was one helpful suggestion, is to use AI more in a group supervision format. Okay, this is the last slide I have here. In terms of some ethical considerations that students reported, there can be what we call this kind of mosaic effect, where despite not using any protected health info that's being inputted into these AI systems, general client details may still be sufficient to lead to unintended identification. So we just want to be careful about that in terms of how much data are we putting in there that could be triangulated and create this mosaic effect. Also, just ethical considerations in terms of misinformation. AI can propagate some false information and sound confident while doing so, making it hard for users to detect errors. So again, we want to be mindful of that and always suspicious about that. In terms of generative AI and bias, so AI does reflect some implicit biases from human-generated content, so need to be mindful and aware of that. Also, minoritized voices may be underrepresented due to the overshadowing by dominant voices and the training data, which can affect the accuracy and cultural relevance of reports for minoritized populations. So we want to be mindful of that as well in terms of how we bring AI into report writing. Just some suggestions that we thought of is report-based AI output to app vendors to help improve the quality. There are reporting features that are available where you can report back that information. And then lastly, always fact check the AI output. Only treat it as a consultant, not as an infallible source. We think that that's just kind of a good principle to operate by. Okay, thank you.
All right. Thank you so much, Dr. Hajowski, for your presentation. I will open the floor for questions and turn off the recording. Meanwhile, there are several comments posted by Larry on the chat, if you want to respond to that, Dr.
Okay,
Hajowski.
thank you so much.